So today's going to just be an overview of a key feature in dentistry. And this feature I would like to talk about is the trigeminal nerve. So uh, while this is regarded as the fifth cranial nerve amongst the 12, it is actually a very important nerve in dentistry. So important, so much that it can be referred to as the eye of dentistry. And this eye of dentistry is a nerve that, without its, shall I say, stoppage of signal, extractions and some other procedures can't go ahead, can't proceed. And so this trigeminal nerve, like I earlier said, is a fifth cranial nerve, and it supplies the face, like the sensory supply of the face. So the trigeminal nerve has three branches. So it has the ophthalmic branch, it has the maxillary branch, and the mandibular branch. So peculiar to dentistry are the maxillary and the mandibular branches. And these branches of the trigeminal nerve supply the mucosa or mucosa of the teeth of the mouth, and also the teeth of the oral cavity. So the maxillary branches supply the upper teeth, while the mandibular branches, or mandibular branch rather, supplies the lower teeth. And the mandibular branch is the largest division. So this mandibular branch, like I earlier said, supplies the lower teeth. And the mandibular division of the trigeminal nerve has several parts. It has a trunk, an anterior division, and a posterior division. This trunk gives off, I think, two branches, and these branches we have the nervus spinosus and the nerve to the medial pterygoid, while the anterior division gives rise to the deep temporal, the buccal nerve, the lateral pterygoid nerve, and these branches actually supply the muscles of mastication. The posterior division, we have several branches. We have the lingual branch, we have the inferior velar branch, we have the auriculotemporal branch. I forgot to mention the masseteric branch also belongs to the anterior division, and this masseteric nerve or branch and the auriculotemporal nerve branch supplies the TMJ, temporomandibular joint, while the anterior division supplies mostly the muscles of mastication. So we have the masseteric branch, like I said, for the masseteric muscle. We have the deep temporal for the temporal division, for the temporalis muscle rather. We have the lateral pterygoid for the lateral pterygoid muscle, and the medial pterygoid supplied by the nerve to the medial pterygoid, which belong to the trunk. So, and my question is, why am I saying this? Why do I have to tell us? Because I've not said anything about the teeth in particular. And the point is that these teeth, the lower teeth, are supplied by the inferior alveolar nerve. So the inferior alveolar nerve gives off branches, and these branches are what supply the teeth. The inferior alveolar nerve supplies the lower teeth through the incisive and dental branches. So those supply the lower teeth. Then for the upper teeth, which is a maxillary nerve. Maxillary nerve gives off several branches. So the molars are supplied by the upper molars are supplied by the posterior superior alveolar nerve. The premolars are supplied by the middle superior alveolar nerve. Then the incisors and the canines are supplied by the anterior superior alveolar nerve. So that's what supplies the upper teeth as a maxillary teeth. And now we get the idea of how the teeth are all innervated by this trigeminal nerve. And without this trigeminal nerve functioning rightly, then the teeth will lose its innervation. And so once you lose innervation, the sensations that the teeth is supposed to feel, like sensation of heat, cold, can be altered. Yes, because of that loss of functionality from the trigeminal nerve. And so if there is supposed to be an extraction, for example, to go on, and this innervation is not inhibited, then the extraction cannot go on. And this is possible through the anesthetizing of the trigeminal nerve. And so you can see the major importance of the trigeminal nerve in dentistry, because without its presence, without its functionality, the teeth can't sense some stuff like the heat, the cold. And with its normal function, without anesthetizing it, then procedures like extraction cannot go on. So you can see that the trigeminal nerve is very important here. It's more like a channel through which the teeth communicates with the central nervous system. That's a bit wild, but that is what it is. So I will just conclude by saying that the trigeminal nerve is very key in dentistry, and its functionality or its suppression during procedures like extraction are very important, and so should be paid more attention. So yeah.